L'azienda farmaceutica AbbVie ha fatto e sta facendo la storia nella cura delle patologie autoimmuni su base reumatologica, dermatologica e anche gastroenterologica. L'azienda oggi ha in commercio 3 molecole, ma la sua ricerca procede incessante. Noi ci siamo fatti raccontare cosa bolle in pentola da chi queste cose ovviamente le conosce molto bene, dal professor Timothy Radstake, Vice President e Global Head Immunology della Discovery Research di AbbVie. Lo abbiamo incontrato qui a Sorrento, a margine dell'evento Remarkable organizzato appunto dalla sua azienda. Tim, first of all, tell us something about the team you are leading, the team of Discovery for AbbVie, which are the people working with you, and also which is the connection between discovery and medical development?
Yeah, I'm glad to do so. So first of all, we are spread over 3 locations. We have 2 locations at the East Coast, in Cambridge, Worcester, which is about 40 miles out of Boston. And then we have a location in Chicago where our headquarters is based. We have a very diverse team. There are MDs, physicians, biologists, scientists overall, but there are also computational biologists, people who know how to handle data and to make big data into molecules. So that's my own department, but as you understand, big data is not everything, right? You have to make a molecule which eventually goes into a medicine. And so we have a very strong collaboration with our chemists, with our people from what we call biotherapeutics, who make protein. And then if an asset goes on the pipeline, there's more and more work together with our cross-functional stakeholders. And then you ask me, when is a molecule handed over to clinical development? Clinical development is in Chicago, and usually we have a strong collaboration with clinical development kind of early in the process. That's where precision medicine, another part of the organization, comes in as well. And around when a molecule goes into what we call tox studies, so safety studies, it's basically when clinical development becomes the lead of a program. Still though, the group becomes bigger and bigger as an asset moves forward, right? So we basically never let a molecule go until it's really into a patient.
And which are the current challenges you are dealing with your team of scientists in your discovery lab?
Yeah, so I guess actually that's not necessarily only for AbbVie. I think the biggest challenge pharma has is how to break through the ceiling effect of treatment. So if you compare 20 or 30 studies in rheumatoid arthritis trials, you always see the same number of patients respond to therapy. And so there is still a huge gap in, for example, getting patients into a cure. And how to break through a ceiling effect is a big question in pharma. And what we are doing within our drug discovery is to really work from human data sets, get samples from patient tissue and blood samples, and really make sense out of the data and go as fast as we can and try to minimize the time that a molecule is in discovery and go in patients as quickly as possible.
You're working to discover, hopefully, the new class of medicine which could ameliorate the life of patients through a more personalized treatment. How they would work or should work, and under which principles?
Yeah, so that's a very good question. And within AbbVie, we are convinced that where we are currently is that we don't understand disease well enough to say, okay, that patient needs that medicine and that patient needs that medicine. And that's why I said before, we have to really understand disease on a molecular level. So we are heavily investing in understanding what we call molecular signatures. And that also means that you go away from a diagnosis approach. So in the end, I think in 5 to 10 years from now, we're treating patients based on the molecular signature and maybe not group them into a diagnosis, which automatically means you're treating them in a precision medicine mode because you're regrouping patients based on that molecular fingerprint, so you know exactly what group of patients to give what medicine and what time.
You have good signs that you will succeed?
I'm completely convinced that will happen. Yeah, it's just a matter of time.